Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? It's Dr. Chris here. Today I want to talk about cancer and its relationship to insulin. So cancer is very complicated. There's lots of factors. Of course, there's genetic factors, there's environmental exposures, lifestyle factors. But more and more lately, we've been seeing some research coming out relating both sugar and high insulin to cancer. Sugars, or glucose, and insulin are a huge part of metabolism, and this is the case also with cancer. So as a reminder, insulin is secreted by the pancreas when your blood sugar is high, so in a state of hyperglycemia, which most of us tend to be hyperglycemic in this country. So what that does is it pushes the sugar out of the bloodstream into your muscles, mostly, and partially into your liver. Because you can't have too much sugar in the blood. It's lethal at a certain dose. And if you've been living a long life of a high sugar diet, and specifically high fructose corn syrup, over time you become insulin resistant, and then the pancreas has to secrete even more insulin just to get to keep you safe and alive. But then you have high levels of insulin, also known as hyperinsulinemia. So prediabetes and diabetes is insulin resistance, is hyperglycemia, is hyperinsulinemia. They're all kind of synonymous. It's just what degree or where are you on that spectrum. So we do know that people with diabetes have an increased risk of cancer. It can be, depending on the type of cancer, twofold or even higher for certain cancers, particularly liver, pancreas, colorectal cancer, endometrial, breast cancer, and bladder. So what is going on here? I'll go over some of the proposed mechanisms. We do know that tumors love sugar, right? So if you get a PET scan, that's one of those images that have multiple colors on it. Basically what they do is they take something radioactive, attach sugar to it, and inject it into you, and it basically finds the cancer. The cancer finds the glucose. So the area where there's a tumor will highlight bright green. This is something called the Warburg effect. This is how cancer cells proliferate. So insulin's primary role is to move sugar into the cell. Basically, all cells of the body have insulin receptors. Insulin comes there and says, hey, I have some sugar for you, and passes it on. So the more receptors the cell has, the more responsive it is. But another role that insulin has is it's a builder. So wherever you have lots of insulin, it makes things grow. That's the sort of relationship between diabetes and obesity. If you have high levels of insulin over time, the adipose tissue starts to grow. In a sense, it's like the illegal kind of steroids, the anabolic steroids. I was just listening to a podcast with Benjamin Bickman, who I'd consider like the most pronounced expert on insulin. And what he was stating is that if you look at breast cancer, so first of all, the two most common cancers associated with high insulin are breast cancer and prostate. But if you look at a tumor, if you biopsy a tumor of a breast cancer cell, it has 7 times more insulin receptors than a normal healthy breast tissue cell. So that becomes kind of like a double whammy, because now, because of all those extra receptors, the insulin is pushing tons more sugar into that tumor, and it's also getting that anabolic effect, that growth factor effect. By the way, we're talking about IGF, the IGF system. That's the insulin-like growth factor system, which include IGF-1 and 2. And we know that elevated levels of IGF-1 are associated with increased risk of several types of cancer. One of the things that IGF-1 does, it inhibits apoptosis. That's programmed cell deaths. Remember, cancer is going out of control with mitosis, and the turnover or the death of some cells is not happening, and that's what a tumor is. So another kind of key role here is chronic low-grade inflammation. So elevated levels can cause chronic low-grade inflammation. We also know inflammation is a risk factor for cancer, as it can create a microenvironment that promotes tumor development and progression. Then what happens next is you get DNA damage and mutations, further increasing the risk for cancer. There's also a bit of a vicious circle reciprocal effect that happens here. So high insulin causes weight gain, and then adipose tissue secretes pro-inflammatory cytokines, making everything worse. And then on the other side of the coin, if you look at some of the medicines like metformin, sort of the gold standard medication for diabetes, it can reduce cancer rates. So one of the things that metformin does is it improves insulin sensitivity and lowers your blood glucose. There's something called the mTOR pathway. That's a pathway that promotes cellular growth and proliferation. And if it gets blocked, you can suppress tumor growth. So one of the things that metformin does, it activates the AMPK, which is the AMP activated protein kinase, which blocks the mTOR pathway. So that can suppress tumor growth. It also suppresses IGF-1, and it may promote apoptosis, so that's that programmed cell death. So it basically does the opposite of everything that I mentioned earlier. Now, I'm not saying go get a prescription for metformin. I'm just saying that there's just more evidence that insulin resistance is a key player. So what should you do? I think you know the answer. It's all the diet and lifestyle choices. Sleep well, reduce your stress, eat a whole foods diet, avoid high fructose corn syrup and processed food, and exercise adequately. These are all the things you have to do to stay insulin sensitive. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.